Hi, this is Caroline. Good evening, everyone. It's good to be back, and we have another special guest and another topic to discuss today. Please let me know that you can hear me loud and clear, and welcome to our Stronger Together online event. And as you can see, there is Saul with us already. Saul, how are you feeling tonight?
Hi, everybody. I'm very, very pleased to be here with you today to help you answer your initial questions and show you a little bit of what a patient coordinator does. Okay, a brief explanation on what is this role, okay, and what we are able to do for you in order to make your journey easy and smooth. Okay,
Perfect. Thank you so much, Sol, for joining us tonight. It's
it's a
very
pleasure.
nice to have you here. And I just want to mention, as you can see, the topic for tonight is important role of a patient care coordinator in assisted reproduction treatments. And Saul Mizrahi, he is actually a patient care coordinator at Clinica Tambre, which is located in Madrid, Spain. So thank you so much for joining and presenting this very, very interesting indeed and very important topic to us as well. Before we start with Saul's presentation, as always, let me mention that all the events have been brought to you so that we can help you out with your struggle. And we definitely want to introduce as many top fertility experts as we can, but also coordinators, fertility coaches to support you, to provide you with some answers. And well, we are definitely here to help you out as much as we can. And as always, I want to mention that those events, it would be very hard to create and bring to you without the help of our ambassadors and partners. And you can see all of them right here on the screen right now. And as always, we will start with the presentation on our topic today. And of course, after that, it will be time for your questions. So all you need to do is type those questions in the chat section, and Sol will be happy to answer them for you, I am sure. And remember, this is being recorded, so if you have any issues whatsoever, you will be able to rewatch it. And I guess we can go ahead with the presentation, right, Sol?
Absolutely. So
Perfect. Thank you so
wonderful, Caroline. Well, firstly, I would like to welcome you all to this event. For me, it's a great pleasure to give you this presentation, to show you this presentation, and explain to you all this process. As I was mentioning before, we would like to explain you how everything works from the inside, okay? What a patient coordinator is able to do for you, and what happens since the very first moment you grab your phone or you send us an email. Okay, what happens within Clinica Tambre to help you with this initial visit and then with you and the entire treatment. Okay, so firstly, I would like to introduce myself. My name is Saul. Okay, I've been working in healthcare for over 10 years. And as being part of the patient care team in Clinica Tambre, I've been having a lot of experience assisting patients since the very first moment until the beautiful end, okay, after treatments when good news happen, take place. Okay, I would like to show you this initial slide. Okay, this is the topic. It's going to be the important role of a patient care coordinator in assisted reproduction treatments. And here you'll see a picture for a beautiful clinic. Many of you might know it from our websites, okay? But this is the first image you will see when you cross our doors, okay? Wonderful entrance where you will meet all the team that has been in touch with you since the very first moment. So let's go to the second slide and let's explain what we will cover during this entire presentation. Firstly, we're going to talk about our team, not only the patient care team, but the entire team that works together in Clinica Tambre to help you, to assist you, okay? All the pieces that put everything in motion for your treatment and to assist you all the time. Then we're going to show you a little bit about our clinic. We will discuss, we'll talk about some things that are features that we have in our high-tech clinic, okay, to ensure your safety, to ensure your privacy, and to ensure that you have a very rewarding experience in this moment. Then we will talk about the highlights, Okay, and the important key points of a patient care coordinator. You might see, or you might believe that there are some tasks we do, but you will learn today many, many other tasks, okay, that you're not aware of, that we are doing to assist you all the time. Then we will talk about the patient journey. Most of our patients, okay, traveling from abroad, they feel sometimes scared when they get the idea that they're having a treatment abroad. With this patient journey that we're going to explain you today, you will see and you will have a full description on what happens since the first time you decide to have a treatment abroad. All the steps will be explained step by step. Okay, so you can have an idea of the process and get used to the idea of having a treatment abroad. Okay, so we can make this process very simple. Then also, it's important to know what will happen when you arrive to Spain. What will happen during your first visit? What will be the key points that you will need to go through once you arrive to Madrid, once you arrive to our clinic, and once you have this first connection, and once you walk through these stairs that I showed you before. And in the end, we will talk about other things, okay, that we are able to help you with, such as helping you with travel, helping you with hotel accommodations, helping you with airport pickups. Everything will be covered slightly afterwards. We will have a question and answer session, as Caroline said, so I can assist you and also clarify any key points that you will need to ask. Okay, so let's move forward. Okay, firstly, okay, we are integrated. We're a multidisciplinary team integrated by a very, very experienced team of of doctors. Okay, our doctors are specialized in complex cases and they have a very, very wide experience in treating patients. Okay, and with many of the treatments available. Okay, the important thing of this team is that the team of doctors work together and they have always communication to make sure that the right decisions are taken towards your case, to make sure that everything will work smoothly, okay, giving you the best of the latest scientific studies to apply it to you and help you and assist you with all this process. Then, obviously, we need to talk about our nurses. Okay, our nurses, which are one of the most important parts of the team, they are there to assist you. They are there to ensure that all the medical treatment is done properly, and they are always there for our patients. They are always there to help you, to make you feel good. We have many patients that sometimes come to our clinic and when they are going to have the blood tests, they say, oh, okay, what's going to happen right now? I feel anxious. Our nurses are fantastic. Okay, they will make you feel that everything is going smoothly and you'll feel that everything will be perfectly fine by seeing them and by having them hand by hand. Then the laboratory. Okay, the laboratory is one of the hidden parts of the clinic that makes the most important things. The laboratory team is consisted by expert embryologists, okay, who are able to perform everything in order to ensure good results. Okay, it's a very, very exhaustive team. They go through every case. They are sure to take the best care of everything that happens upstairs. Okay, and sometimes you never see their faces while you are there, but you can be sure that they are always there. They are one of the most important parts of the treatment to assist you and to also make things in the best way to have the best results. Then the patient care team, which is what we will focus today, okay, and all the tasks. We will be there all the time to talk to you, to be in between you and the doctors, between you and all the team, okay, to help you and to answer your emails on time, to answer your phone calls on time, and to give you a feedback on how everything is going on. So you won't feel that you're having a treatment abroad. You will have a constant communication with your coordinators during the entire procedure. And finally, complementary therapies. Our clinic believes in complementary therapies, okay, as part of the well-being of our patients. So that is why we have okay, many options, okay, for you to feel good during your process, to feel safe and to feel relaxed, okay, while you're doing this procedure, including a lot of specialists like physiotherapists, acupuncturists. We all have connections with teams that are able to assist you and give you what you are looking for in our clinic to make out of this experience the best. About our clinic, okay, here are three pictures of the spaces that you will see when you come to Clinica Tambre in Madrid. The first thing you will see in the main lobby, okay, is a hall where you will be received by your patient care coordinator, okay, and our front desk team or reception team. We do have, as you could see in your in the second picture, individual waiting rooms. Okay, we did this in the since the very beginning to ensure privacy. Okay, as you might know, this moment is a very emotional moment that requires this space. Okay, to talk about things. Okay, before going to a consultation with the doctor. In Clinica Tambre, we designed individual waiting rooms. Okay, with doors where you can close and you can feel in a small place safe, okay, and apart from the rest of the patients. Okay, so you will have all the privacy you need for the procedure and during your visit. Nowadays, with the current situation that's happening worldwide, and we will talk about that later, these spaces are more useful. Why is this? Because now, besides having the privacy, you'll have the safety of being apart from the rest of the visitors at Clinica Tambre at the same time. So you'll have individual waiting rooms, okay, keeping all the social distancing necessary and all the security measures that our clinic has to now, okay, available to assist you and help you and make you feel that you are safe. Then the third picture is one of our rooms, okay, our suited rooms. Okay, we have suited rooms at our clinic where you can rest before all the procedures, okay, before the egg retrievals, before the embryo transfers. You will have this space to relax, to prepare for the procedure, and then to rest after the procedure is done. So this way you will have, besides having privacy, you will have time to prepare and concentrate and also to relax. Okay, you'll see these are rooms that are equipped with everything that's needed in the medical part, but still you will feel that it's like a hotel room. Okay, it's very, very smooth. It's very, very easy, and it has everything you will need. Okay, patient care coordinators, what are our tasks? Okay, and here we divided in different points, different key points that we will need to explain one by one. The first one is that we are there to receive your first contact. Your journey in Clinica Tambre will start with a first contact, okay, where we can receive a call from you, we can receive an email, okay, or we can receive a contact request through our website. Okay, so once you do that, okay, one of us will be there receiving that request. We will be there to call you immediately, okay, to answer your inquiry. And if we're not able to reach you at that moment, okay, we will send you an email asking for your availability to schedule the right day and right time to call you. So you can feel that you can talk easily if you are in working hours or if you are in a place where you're not able to talk freely. We will ask you what is your choice of time so we can find the best time to have this initial call. This initial call is very important because we will learn about your case. We will write the key things, okay, that we will need to talk to the doctor and tell the doctor first. And also, we will understand, okay, your current situation to assist you and give you the best recommendations. Okay, the idea is always to help you have a first consultation with one of our specialists. Our goal is to have you here to take good care of you and to take you through the right pathway for this fertility journey that will start. Okay, so we will help you, we will assist you, okay, with this initial call, okay, giving you the first consultation at our clinic, okay, which is totally free. This first consultation in Madrid is free. You will be able to be here, you will be able to talk to the doctor, okay, and we will receive you since the very first moment. Then the second key point is accompaniment. Okay, we take you by the hand, as it says on the slide. Since you cross the doors of Clinica Tambre, the same face that received your first call, the same person that answered your emails all this time before your flight will be there, giving you the warm welcome to our clinic, okay, and assisting you since the very first minute. We will be there to give you everything you need, to give you all the forms you will need to fill. We will be there all the time with you. Even we will take you to the place where you need to take the blood tests if it's required, and every single test. We will be there with you, assist you all the time, and always will be taking care and making sure, okay, that the timing of your stay is going on perfect. Okay, that you're having your consultation on time, and that you are able to have everything completed during your first visit. Then communication between teams. As you can imagine, okay, the communication is very important within the teams of Clinica Tambre, the medical team, the embryologist team, okay, and the patient care coordinators, the doctors, okay. We need to build this communication for your case all the time. Okay, so we are there to do that, okay, to create this environment of communication for each case, to connect, to talk to the embryologists when it's necessary, to talk to the doctor, to ask specific questions if those are required. That is also part of a job of a patient care team, patient care coordinator. Obviously, we need to have a full understanding, okay, of fertility treatments. We need to have a full understanding on how the procedures work to give you the best assistance, okay? Hand by hand with the doctors, your patient care coordinators will be all the time assisting you, giving you the best advice on how to do things. If you have trouble by having the medication or you need assistance on how to do it, we will be all the time there to assist you. If you require additional support, we will be there to assist you. If you have any questions related to your treatment, we will be there to assist you. Also, one of the most important parts is generating empathy. Okay, for us, our patients represent a lot. Okay, when we receive this first call with a patient, we build a very interesting connection. We become at that moment your best friend. Okay, we become at that moment the person who is listening to your case and guiding you through all this journey. Okay, to make sure that the results are positive, to make sure that your experience at our clinic is smooth, it's easy, okay, and obviously as simple as possible to make the results we expect, to have the results we expect, and to celebrate together, because that is our first goal, celebrating with you a good result. Then organization. As you know, it's essential for a patient care coordinator to be organized, to have everything in hand, okay, and to put everything in place so everything can be perfectly scheduled, okay, and everything can be perfectly booked. Sometimes we require our patients to send in advance previous tests or medical records. We need to make sure that everything is in the right place, that everything is seen in the right moment by the doctors, so you can have a proper feedback during your consultation and you can have the best advice, the best diagnosis, and the best treatment protocol available for your case, for your personal situation. As you know, each patient is unique. Each patient is different. So we will need to have this approach, this individual approach, to make sure that your treatment is very personal and that everything goes straightforward as it's indicated by your doctor and your specialist. Let's go to the other slide. Okay. What other tasks, okay, we do in this uncertain times? Okay, and this is a question that I'm sure that you will be making very soon. because now there are some inquiries about what is happening here. Okay, the first thing is that organization is essential. Okay, so your patient care coordinator will organize everything of your visit. We will schedule the appointments on time and with the right timing to make sure that your stay at Clinica Tambre is as useful as possible. Okay, and not wasting valuable time. Okay, when we can use it wisely. Okay, and we can take advantage of every minute to have everything done on time. Okay, this is organization, and we are here to do that. Then nowadays, okay, we need to be aware on what are the updates of the mobility restrictions worldwide between countries, international legislation. Okay, we're in constant communication with the embassies. We're constantly, okay, seeing the latest news in the last minute to make sure that we are giving you the right information, and we can help you and we can tell you that it's safe to come to Spain for your treatment. In case, okay, there are some requirements, okay, we're able to provide everything you need. As you know, a medical treatment is an essential reason to come to Spain. So we are able to give you a letter saying that you are flying to Spain for a medical treatment, so you won't have any problems, okay, during your visit. Then other important parts that we will guide you on how to travel to Spain. Many of our patients never been to Spain before. Okay, so we need to guide them in the proper way. So we will assist them on booking hotels. We have some agreements with some hotels which are close to our clinic, and we can organize everything. Okay, to make sure that you have a hotel reservation and also airport trips. Okay, we're able to organize that for you. So you just land in Madrid and you will have everything taken care of since that moment. Um, let's go to our next slide. Okay. Um, Other questions, okay, that we receive all the time is that are there any tests or procedures that I can undertake in my country? And the answer is yes. Okay, everything starts when we start talking about the patient journey. We will explain everything on detail. Okay, but just to let you know, we have a system, okay, an online way of communicating with you that allows us to get close to you even if we are in another country. This means that with the constant communication that we will have with you, you won't feel that you're having a treatment in another country. You will have this contact all the time. You will receive the calls on time, okay, from our coordinators and from our doctors when you have your consultations booked. Then we have a network of international health centers. So this means that if you're required to do an ultrasound, if you're required to have further tests done in your country, we're able to find you and recommend you a place where everything can be done easily, okay, and that our indications are accepted. Then, other question that might arise is about medication. Okay, many of our patients are concerned in the first moment on how I get the medication. Is there a way that the prescriptions that you do will be accepted in my country? And the answer is yes. Okay, when some patients come to the first consultations, they even buy here everything here in Spain. Sometimes they prefer to buy it here and then take it with them so they can have everything prepared to start the process. Or sometimes many patients prefer to buy the medication in their own countries. We do have ways of doing this. Okay, we have online pharmacies that are able to send you all the medication to the door of your house. Okay, so you don't need to worry about that. Okay, so that is something that we as coordinators organize, and it's essential for the smoothness of your treatment. Let's go to the next slide. Okay, a patient journey. Okay, we'll explain how everything starts. Okay, and how the entire process looks in just one slide. Okay, the first part, as I mentioned, is the first contact. Okay, as I mentioned before, we receive your call, we receive your contact request, and we will call you immediately to hear you, to understand your case. Okay, to get to know you, which is the most important part, and to help you to have an appointment with a doctor. on the day and time that better suits you. So this means that if you're planning to have your first consultation in the next weeks, okay, we will be there in this call. We will let you know what are the available options, okay, for your consultation, and we will help you plan ahead everything for this moment. In this first contact, okay, we will ask for you to send us everything that you can have, every medical record or blood tests, even blood tests that you have from less than 1 year. You can easily send them to us. So this way we can upload them to your medical records and have the doctor to check everything before your visit. So this way the doctor is already aware of your case and is able to give you a diagnosis based on a previous study done with your tests and your medical records. Okay, so at this moment, okay, we plan your visit, okay, and at this visit, we will receive you, okay. You will have a consultation with the doctor, okay, where she will make you, she will review everything. She will make you a full evaluation. She will perform an ultrasound. She will indicate which are the tests you need after seeing everything you already provided to move forward with your treatment. Also, she will give you a treatment protocol. Okay, this treatment protocol includes all the details of the treatment, when you will need to start the medication, when you will need to have your ultrasounds. Okay, and if you need or if you want to have those tests, it's important to tell you that they can be easily done in this first visit. So it will be a very, very straightforward day. You will come to the consultation, the doctor will see you, you will have your tests done, then you will sit with one of us so we can explain you all the details of the treatment. We will explain you how about the paperwork and all the other details, okay, that are required to know. And then you can easily fly back home on that same day. What we encourage you is to stay a few more days because Madrid is beautiful and there are many things to do during your first visit. Okay, we're also able to help you with that. Then, once you are home, you can start all the treatment, you can start the procedure, you can start taking your medication. Okay, and when you're ready, okay, you will be flying for your second trip to Spain. And the second trip, depending on the treatment that you are undergoing, the stay will be shorter or a little bit longer. Okay, at that time, we will be there with you as well. We will take you to your room. We will indicate everything before the procedure is done, after the procedure is done. We will give you all the information. We will give you everything you need, the prescriptions indicated by the doctor, all the indications. Your doctor will be there with you all the time, giving you the recommendations. Okay. And then we recommend you, after having the procedure, to fly home the next day so you can rest, you can relax, you can unwind after this process. Then, when you arrive home 10 days later, you perform the blood pregnancy test and you tell us the good news. And there is the moment where we celebrate with you. Okay, so this is the patient journey. This is how it looks. And we have all this information online on our website, so you can easily access to it, okay, and also ask for your first consultation to get in touch with any of us. Let's go to our next slide, okay? And this is what I just mentioned. What does the first visit look like, okay? Is initially a complimentary ride from the airport in one of our taxis. This is something I didn't mention before with the clinic, okay? If you're flying to Madrid for your first consultation, we will provide you with the airport pickup service for free. We will pick you up at the airport and bring you or directly to the clinic or to the hotel where you're staying. If you're planning to stay a little bit longer here in Spain, then you will have your appointment with the medical team, okay, with your doctor, okay, the doctor that will be taking your case since the very beginning and who will be all the time with you until the treatment is done, okay, and 12 weeks, okay, after the treatment is done, following up your pregnancy. Then after this appointment with the doctor, you will meet with us, with the patient care team coordinator, who will be there with you, as I mentioned, explaining everything about paperwork, explaining everything about the treatment and how to move forward. And then, as I mentioned, we will be there with you you require to do all the tests you need here on the same day at our clinic. If you need to do an ultrasound, okay, or in case you come here for a pre-test like an endometrial biopsy, okay, we will be there all the time. Then, another important part. So, Madrid is a very multicultural city and it has a lot of beautiful things to see. Okay, the most important part is that the location of our clinic is 20 minutes away from the airport. We're in a very, very nice neighborhood, close to the most important places to visit in Madrid. We're close to downtown. We're close to the airport, and we're close to the best museums in town, okay, and all the shopping places as well if you decide to see a little bit more. We will also assist you with that, okay? Our team has the best recommendations on places to go during your visit to make sure that your stay is nice and safe, and also we will give you good recommendations, even on restaurants, because we have a lot of good experience with that. Then, what else we can do for you? And this is a very interesting question. We have a regular exchange all the time of information and communication between our different teams. Okay, as I mentioned before, we are the connection between you and the embryologists. We are the connection between you and the doctors. We are the connection between you and every human being working for you at the team of Tambre. We will be there to know that all the communication is going fluently and that we are all aware on your case to make sure that the results are positive. We even attend fertility events. This is a very common practice from our clinic, okay? We fly to places, okay, and we go to events to explain about our clinic and to have this initial direct contact with our patients that are looking forward to have consultation, who are looking forward to know more or learn more about a fertility treatment. We always, okay, go and do these visits, okay? Currently, we're undergoing international consultations, okay, and when all the events, okay, take place, we're always make sure that we have a nice space there, okay, so you can visit us anytime. And also, one of the most important things, and that's why we're very thankful of being here, is the cooperation with external partners such as platforms as Egg Donation Friends, have My IVF Answers, and that's why we're here all the time, to be in touch with you, to have this channel of communication for all the questions you are willing to make us, okay, to assist you in all this process. So this is the presentation, okay? We will encourage you, if you would like to communicate with us, you can easily contact us through our website or through the email information@clinicatambre.com. I'm going to write it in the following minutes in the chat, so you can have the email address and you can contact with us directly anytime. Okay, so now thank you so much for your time. I guess we had the first half an hour of webinar, and it would be a very good time for starting with your questions. If you have them, I'll be pleased to assist you as best as I can.
Thank you so much, Saul, for explaining all the steps. It was a very thorough explanation indeed. And thank you so much. It's always a pleasure to cooperate with you and anyone from the team. So, again, I'm very happy to have you with us tonight,
Thank
indeed,
you.
as well. And yes, you are very right. It's time to start our Q&A session. As you can see, there are some of the questions ready. And of course, to the rest of you, if you would like to ask anything, this is your time to do so, and Saul will be more than happy to answer all of your questions. And let's go to the very first question that we received. And here's the question for Saul. Do you know how can I get visa for treatment?
Okay, well, Ahmed, firstly, hi. This is a very common question, okay? We receive this oftenly. Sometimes for some patients, depending on the country where they live, sometimes it's a challenge to come to Spain, okay? What we do with the clinic is that we can facilitate a letter saying that you are flying to Spain for a medical treatment. Some of our patients, and most of our patients receiving these letters, they need to go to the embassy of Spain in their own countries. And with this letter, most of them, I can say that all of them, because I haven't had recent denials, they have had the permission, okay, and the authorization to fly to Spain. Okay, the visas has been issued because, as I mentioned before, a medical treatment, okay, is a strong reason to come to Spain. So we, as a serious clinic, we're a clinic with over 40 years of experience in the field. We're very well known, not only locally but internationally. Okay, and by giving you a letter saying that you are coming to Spain for a treatment, okay, you shouldn't have any kind of problems with the visa.
Wonderful. Thank you so much for explaining this question and, of course, for your first question as well. And next question from the same patient: How much is the cost for IVF with medication without PGD?
Okay, well, Ahmad, we have different plans. Okay, as you know, everything starts with this first consultation where the doctor will recommend which is the best IVF treatment for you. Okay, we have the regular IVF, we have the IVF with pre-genetic screening, or we have other ways of doing your IVF treatment. The costs, okay, can start from 4,995 euros. However, I recommend you to contact us directly, okay, so we can give you a personalized cost estimate, okay, based on your specific case and what you will need. Okay, the medication, and this is another important question, it's not included in our treatments. What we are able to do as a clinic is to provide you with the prescriptions, okay, and you can go to any pharmacy in Spain or at your country and buy the medication. Just to give you a broad idea, an IVF treatment, medication for IVF treatment is around 1,200 to 1,300 euros here in Spain. Okay, it will depend on the pharmacy you go, but that's the average price. So you can have an idea and compare it, okay, with the prices in your own country.
Excellent. Thank you so much once again for explaining this one as well. And let's have a look. And of course, there's a thank you from Imad as well. Um,
Anytime.
excellent. And there's another question right here, a bit longer one. So, do many people opt to stay in Spain? So, no second trip. I would be afraid to go home and then not be able to return for the second portion of the treatment, given the pandemic situation upcoming this winter. How do you think this will go? How long would it be to make it one long trip, combining the first and second trip? Yes.
Well, Vanessa, thank you for so much for your question. And well, believe it or not, this is another question that I've been asked always. Okay. Um, Understanding the current situation, okay, and some travel restrictions or some limitations when patients fly back to their countries, we have many options, okay? We have the options of having a treatment in one visit. However, it is important, for example, with an IVF treatment, why we recommend to come here to Spain for a first visit. Because initially a sperm sample needs to be left, okay? And this sample, if it's okay, it will be frozen and studied for the procedure. Other options we have is that we're able to give online consultations. And instead of having the on-site consultation, we can have the online consultation. However, always our recommendation is to be here. If this is the case, okay, considering or imagining, okay, a hypothetical case that there could be a situation happening next, okay, which we do not think honestly it will happen, we do have the option, okay, of starting the preparation back home, okay, and then only come for the time of the egg retrieval and then the embryo transfer. It's important to know that you will need to be here the day before the egg retrieval. Okay, then the next day, okay, when we retrieve the eggs, okay, your partner, okay, will be able to leave this fresh sperm sample so we can fertilize the eggs, okay, and wait 5 days in the incubator until we're able to perform the embryo transfer. Okay, this is in case of a regular IVF. In the case of egg donation, okay, it can easily be done also in one trip, working in the same way. However, the doctor will need to study, okay, the sperm before and let you know if it's possible to leave this fresh sample in the second visit. Using donor sperm. Okay, well, with using donor sperm, it shouldn't be a problem at all, because your second visit, your visit to the clinic, will be only for 3 days in the case of egg donation. Why is this? Because if it's an IVF with donor sperm, okay, what we will be able is to fertilize the eggs the day of the egg retrieval with the donor sperm that we already selected for you, okay, and then 5 days later you can easily perform the embryo transfer. So yes, it is a possibility, Vanessa. Okay, if you would like to learn more about that, just let us know, and we can easily give you a call and explain you all the process, all the detailed process, okay, and how to do it. But yes, it's a possibility.
Oh, wonderful. Thank you so much for the thorough explanation once again. And of course, there's a there's a comment from Vanessa here as well. So just
Mhm.
want you to see,
Sure.
hoping to try no X first round. Thanks.
Okay.
And of
Well,
course, there's a thanks from her as well.
anytime, Vanessa. It's a pleasure.
Perfect. Thank you so much. And there are a few questions as well in regards to this. So let me show two of those. Okay, so they are regarding the same. So, what are the laws in Spain for donors and surrogates? So, could donors or surrogates be family members? And what are the costs for donors surrogates? So, I will show you, of course, the first one right here.
Okay, so well, MN, this is a very good question, and thank you for asking it. There are two important things to know about the legislation in Spain. Well, three things, okay, about your question. The first thing is that surrogation is not a possibility in Spain. Okay, that is the first part. Act donation is perfectly possible. Okay, however, the law says two important things. The first one is that the donors are completely anonymous. This means that the doctor will be the one selecting the right donor for you according to two different criteria. The first one is blood group compatibility, and the second one, okay, is physical characteristics. So this means that the doctor will find a donor for you that's compatible with you and that looks like you, so the baby looks like you. Okay. Um, Using those principles and understanding that, okay, it's perfectly possible to have an egg donation treatment in Spain, okay, to select the proper donor for you and do it. But surrogacy is not allowed, and egg donation under these conditions.
Okay, excellent. Thank you for that as well. And sorry, there's one more here. So, what is the
Mhm.
waiting time to get a donor?
Okay. Well, I will answer part of the circuit, as I already explained you that surrogacy is not allowed. But normally, the waiting time to find a donor is about 2 to 3 weeks. It will be only the time to find the right donor for you, a compatible donor for you, and a donor that looks like you. For to find a donor that looks like you, we count with technology. Okay. Besides, you will fill a physical characteristics form. Okay. We have phaноmatch technology, which allows us to select from the donors that were already selected by the doctor, to choose to see their pictures, okay, and with the system compare them with your picture, okay, to find the donor that has the best match. This is a process that won't take long, okay, and as I mentioned, okay, it could be 2 to 3 weeks approximately.
Oh, wonderful. Thank you so much for this as well. Okay, for now at least, it looks like that might be our last question. But of course,
Mhm.
if you would like to ask anything else, just go ahead and type those questions in the chat section so that's all can help you out. But of course, if you have any follow ups or would like to get some more details, remember you can always get in touch with Saul and his team. So if you could just go ahead and type the your email address just in case as well in the chat section. You are more than welcome to do that. And next question, let me just show you that. What is the maximal age for women for treatment?
Also, interesting question, and Amen, and thank you for saying that. The maximum age is 50 years old. Okay, however, this needs to be evaluated by the doctor. Once you have the first consultation, okay, as you know, each patient is different. The doctor will tell you if, with 50 years old, okay, you're able to perform a treatment or not. Okay, it's important to know that the recommendations are based on scientific evidence, and the doctor will give you the best recommendation to make sure that there are no further problems and that you have a successful result.
Excellent. Thank you so much again for that question as well. Next question is right here. Is it possible to request that the sperm donor be from Spain, or is the best match overridden by phenotype only?
Well, Vanessa, thank you for your question again. Okay, as I mentioned before, the legislation is very strict. Okay, so this means that the only criteria to select a donor is blood group compatibility and physical characteristics. Okay, so this means that we will find a donor that phenotypically matches you and a donor that's obviously compatible with you. Many patients ask, is PhenoMatch used as well for sperm donors? Yes, it is. Okay, PhenoMatch is used for all donors. Okay, and all our donors need to pass through a very exhaustive selection process to be part of our pool of donors. But yes, PhenoMatch is used. We cannot choose any donor based on nationality or culture or heritage. Okay, this is only the selection criteria.
All right. Thank you once more for your question and, of course, all for your help. And next questions are coming up. So let's go ahead with the next one. So, is embryo adoption possible at your clinic?
Yes. Hi, Anneli. Thank you for your question. It is an option. Okay. We do have the option of creating an embryo from egg from our bank and from sperm from our bank. Okay. This is what also, it's important to know that we will use PhenoMatch technology for that. But there is also the option of adopting an embryo, okay, and having an embryo that maybe another couple decided to donate to another couple. Okay, so this is also an option. However, we will need the waiting time will be longer as we need to find a compatible embryo. Okay, for our patient. Okay, compatible. Why? Because we need to find embryos done from gametes with the phenotypical characteristics that match the recipient mother. Okay, but it is a possibility. Okay, what we always recommend is to maybe have a procedure done using the regular techniques. But yes, it is a possibility as well.
And excellent. Thank you so much for yet another question from you. And of course, and for your help. Okay, next question is, are you working with other countries for cycle monitoring?
Yes, well, what we are used to work with international patients. Okay, so this means that each coordinator, we have a multilingual team of coordinators. We have a network of places where you are able to have treatments done. For example, in the United Kingdom, which are most of the patients I work with, okay, English-speaking patients mostly, we do have places, scanning agencies, where you can easily go to have your ultrasounds done. You can easily go to have your tests done, okay, and have everything prepared for your treatment. Okay, but yes, we do have an international network of clinics and diagnostic centers able to assist you.
All right, wonderful. Thank you so much once again. And there was a follow up from Vanessa, okay, in regards to the embryo adoption.
Sure.
So, how much is embryo adoption typically, between that and phenotype match egg and sperm, which is more expensive?
Mm, Basically, what we do here is that the treatment, okay, what we do for the treatment is charging for the procedure of performing the transfer for the medical assistance of your preparation. Okay, normally, okay, the embryo adoption treatment, okay, is a treatment that involves, okay, only to transfer an embryo, okay, that was already created, okay, and it's less expensive than creating a new embryo from frozen eggs and frozen sperm. Okay, Vanessa, if you would like to have more information and you would like to receive the cost estimates, okay, of this process, okay, of this kind of procedures, just let us know. You can easily write us to information@clinicatambre.com, and we can give you a call. We can explain you all the options available, and also we can send you the cost estimates.
Excellent. Thank you so much, of course, for that. And at least at the moment, there are no questions. However, I just want to mention that, as Saul has mentioned, you can definitely go ahead to the website link I will send in a second, and that way you will be able to get in touch with Saul and his team so that you can get even more details. I'm sure they are also able to offer some consultations, online consultations, and I'm sure that will be quite helpful for you. And here's the link, of course, right here for you as well. Next
Perfect.
one is one more question here. Are there any restrictions in this time with Corona?
Well, to be honest, no. There is a limitation. There is a curfew that I guess is happening in many countries that from uh, 12 from midnight to 6 a.m. It's not possible to be in the streets wandering, but there are no limitations to travel to Spain. Okay, as I mentioned, if you come for a justified reason, such as a medical procedure, there shouldn't be any problems. There are no problems, and we haven't had any kind of problems with that so far. Okay, the limitations, okay, they depend on the countries. Okay, the most challenging situation we've been experiencing with patients from the UK is the mandatory quarantine that sometimes they need to take when they return from Spain. Okay, so for this, we can also we cannot do anything about it. But to come to Spain and to have everything done here, there are no restrictions. Also, the safety measures that we have adopted in our clinic are very strict. Individual waiting rooms. Okay, we have everything is disinfected. Social distancing is very important, and wearing a mask is now mandatory, not only in our clinic but in Spain in general. If you come to Spain, you will see that even if you are in the middle of a park with no one surrounding you, you need to wear a mask. Okay, so this is something that it's mandatory and it's helpful to keep the safety, okay, and to maintain safety and avoid the increase of cases around. Okay, but those are the measures. But to fly to Spain, there are no problems. We're receiving normally patients. Okay, it only will depend on the restrictions of their countries once they fly back from here.
All right, that's well good to hear. I mean, every one of us is definitely worried and are thinking,
Yeah.
what else can we do? But it's good to hear that there are options. Yes, it's still possible. So thank you so much for your question, indeed, as well as your help with that. And we will be finishing for today. As you can see, there are some thank yous coming up your way. Thanks. There's the first
It's an
one,
honor.
and there's the thanks. Great presentation.
Thank you
And there's
so
another
much.
thank you as well. And one more for you right here. So
Thank you.
thank you so much, everyone, for joining us tonight,
Anytime.
for your questions, for Saul, for your time indeed as well, and of course for being with us tonight, for explaining how everything works and giving us a little bit of hope, I would say as well. And thank you so much for sending the email address. So once
Sure.
again, remember that if you would like to get in touch with Saul and his team, the link, the email address is right there for you in the chat section. And well, Sol, is there anything else you would like to add?
Yes, I would like to thank everybody who joined this event. Okay, I'm very, very pleased to be here with you. I'm very pleased to give you this information that for most of you was unknown. But I hope that since today you are aware of what a patient care coordinator is able to do for you. And since now assisting you in everything you need, in every question you will need, just contact us. We'll be always here to assist you. Thank you so much for your time. And thank you, IVF Media, for this wonderful opportunity. Caroline, thank you for everything you have done. with us.
Thank you so much. It's always, always, always a pleasure to work with you and your team, and you know it. So thank you as always. It's great to have you here. And let me just remind everyone that this has been recorded, so you will be able to find it on myivfancestors.com tomorrow, and of course, it will be uploaded on our YouTube channel. So I can only encourage you to go ahead and subscribe to our YouTube channel. That way, you will know when the video is uploaded. And of course, you can find all the rest of our past webinars on My IVF Answers, but also on our Facebook or Instagram. And if you follow them, that way you will know that there are more and more of those events coming up. As you know, we will not stop with the webinars until the middle of December. So we still have plenty more of those events coming up. And once again, thank you everyone for joining, for your questions, and have a wonderful evening. And I definitely hope to see you back here tomorrow and the next days as well. Saul, again, a great pleasure to have you.
An
Thank you so
honor.
much for your time. And
Thank
of
you.
course, I know, well, I know you will